My name is Taylor Harris. I'm originally from Greenville, South Carolina. I've been in the Asheville area for about 2 years. I'm one of the orthopedic surgeons at EmergeOrtho, specializing in sports medicine as well as hip preservation, for which I did fellowships in each, specializing in minimally invasive techniques to get people back to doing the things they love. I got into medicine partly from some time that I spent with Richard Hawkins, who's a famous world-renowned shoulder surgeon in Greenville, South Carolina with the Steadman Hawkins Clinic. I always played sports growing up and was drawn to sports medicine, but I think working with somebody like him certainly it made the field very attractive to me. What I like most about sports medicine is certainly taking care of athletes, but it's not just people getting back to playing sports. It's something I can relate to. When I get injured, I want to get back to enjoying the activities that I love. And so that's what sports medicine is for me. Certainly it's on the field, but also it's just the field of life, getting people back to what they enjoy. Part of my unique subspecialty is being both dual fellowship trained in sports medicine as well as hip preservation. Sports medicine is your more classic arthroscopic or minimally invasive interventions such as rotator cuffs, ACLs, things like that. Hip preservation is a subspecialty of sports medicine where we focus on minimally invasive arthroscopic hip techniques to preserve the hip joint, but also to better evaluate when you have that 40, 50, 60-year-old patient who's kind of in between preservation versus replacement, being able to give an expert opinion on what is the next best step. I do my surgeries primarily outpatient, so gone are the days where we admit people into the hospital. These are multiple surgery centers in the area in which we're able to efficiently and effectively, from a team standpoint, get people in and out safely for their surgeries. One of the big benefits of not having to stay in the hospital is twofold. Number one, it minimizes infection, which is huge for all surgeries, but certainly our joint replacements. And number two, it's been proven in multiple studies that it is a much quicker functional recovery to get people home sooner. From a sports medicine standpoint, EmergeOrtho has long been a leader in on-the-field coverage, whether that be high schools throughout the area or at colleges such as UNC Asheville and Mars Hill. This really started back with Dr. David Cappiello and was continued with Jay Jansen, where the standard of being on the sidelines as physicians, present at the games, taking care of the community certainly was set and has not since been replicated. What I enjoy most about EmergeOrtho is the standard of care of excellence in the region that it has been for many years. I was recruited by Jay Jansen, who set the standards for sports medicine roughly 25 years ago, as he completed the same fellowship at Andrews Sports Medicine that I did. This standard of care has been continued by Robert Boykin as well as Andrew Kirsten, and being able to join such a team with the depth and quality of care as that from a sports medicine standpoint has truly been a dream. One of the unique things about EmergeOrtho is being such a large multidisciplinary group. We have all the subspecialties from hand to foot and ankle to sports medicine to complex reconstructive surgeries, in addition to spine, where when I'm on call and I see a patient that maybe isn't under my subspecialty, I have plenty of colleagues that are able to take care and are willing and available to take care of these patients, which I think elevates the standard of care.